We're speaking this morning to Dr. Anbarasu Ramalingam, who's the chairperson of Mercy Malaysia Sabah chapter. Good morning, Dr. Anbar. Thank you so much for taking time to speak to us this morning.
Good morning, Bel. Good morning. Thank you for the opportunity, and good morning from Sabah.
Well, tell us firstly about your role with Mercy Malaysia.
To begin with, I'm Dr. Anbar. I'm currently chairing the Mercy Malaysia Sabah chapter since the year of 2017. Yeah, I started off as a volunteer from the year of 2011. Been with Mercy Malaysia for the last 9 years. So it was, starting from the ground, knowing the basics and working the way up. Yeah.
Okay.
But you're with the Queen E Hospital as well, though. I mean, that's your full-time gig, right?
Yeah. My current position is Ketua Penolong Pengarah. I'm more based for hospital development and planning and things like that. But in times of crisis, we take over ad hoc plannings and crisis management. So whatever that complements the clinical service.
Okay. Yeah. But as a chairperson of Mercy Malaysia, especially in Sabah, so do you deploy the volunteers of Mercy Malaysia if any disaster or crisis were to happen in Sabah? Is that right?
Yep. Mercy Malaysia has been existent for about 21 years. Sabah chapter for the last 16, 17 years. So you work hand in hand, being a chapter of Mercy Malaysia. So what happens in usual scenarios is that we'll try to deploy volunteers from within the state, and if assistance is required, we will get volunteers from Semenanjung as well. But what is happening in this situation is that most of our medical volunteers are KKM-based volunteers. So the Sabah medical volunteers are tied up with their routine work, could not come up and volunteer, or they need to steal time to come and volunteer for short-term basis. So right now, Mercy Malaysia, our headquarters, have deployed several volunteers to come down and help us with the screening, mostly with the public health services. Yep. So internally, our non-medical volunteers are running, sending logistics, sending food aid, sending PPE supplies and medical equipments to the hospitals around in Sabah.
Okay, so this is during this COVID-19 crisis in Sabah.
Yes.
Okay, but we read that Sabah's resources are extremely stretched right now. Frontliners are exhausted mentally, physically. PPEs are urgently in need. Hospitals are running out of beds. Can you give us a more detailed picture of the situation on the ground in Sabah at this moment?
I can't speak for all the hospitals in Sabah, but I can give a general picture of some of the major hospitals. Queen Elizabeth per se. I think first of all, you have to start from the perspective that this is a crisis. Crises are not meant to be comfortable. Crises are not meant to be, workable within the pre-existing conditions. So there is a lot of stretching that has to be done. The question that lies around here is how long can we stretch, or how far can we stretch? Okay, beds are running out. Like Queen Elizabeth per se, we have been opening up a lot of wards to compensate, to open up for patients. We went from a partial COVID hospital to a full COVID hospital, synchronous to the increasing number of cases in Sabah. But to say that we have ran out of beds, I think it is not exactly precise. The usage of the bed is quite high. That is a fact. But to say that we don't have any more beds available, it is not exactly precise, especially in the sense for Queen Hospital per se. Logistics are stretched. We are using more PPEs, but as in PPE supplies, I think we are better supplied compared to the first wave. The first wave, I think we were seeing the numbers rising, but nobody expected that the usage will be as such. And the protocol of the usage, how frequent we use the PPEs, the frequency of us going in and coming out of the zones, all those were unregulated. But as it comes to the third stage, the third wave right now, I think we are better prepared. And we were also anticipating the second wave, which did not happen in Sabah. So the supplies are all right. But I suppose there could be issues with coordination and procurement because the supplies are centralized and being sent to different branches. And the same team is the one that conducts the clinical work as well. It could be possible that the supplies are not being requested earlier, or whatever they're supplied, sometimes the usage surpluses. So donations per se, it is helpful. Good people who come with good intentions are always minusing the burden, or reducing the burden of the whole system. But the supplies are adequate, if you ask me. But when you talk about ICU-based medical equipment and things like that, the needs at this point is definitely higher.
Yeah,
that's a fact. I think we have to accept that. And how high it goes, I think only time can tell us. So whatever help that comes in, whatever that's being purchased, whatever budgets are being approved, it definitely comes as a comforting factor, as a factor to optimize the care that we're providing in the hospital.
Okay. So in your hospital per se, Queen Elizabeth, you have enough ventilators, enough beds in the ICU, because we've actually read articles that says that some critical patients had to wait 2 days before they can be admitted into the ICU. And a lot of asymptomatic patients have been asked to just stay at home and were not transferred to quarantine centers because they say that they were full. Is that all true?
I think I would actually assume that everybody has good intentions of creating realization or trying to put a positive momentum on the government to support the Sabahans or the system that's running here. But the fact per se is that anyone who's in critical condition, who's waiting to be admitted, are usually being told to call 999. For admissions, in case of any disturbing symptoms that rises. It is totally not true that patients are waiting for 2 days who are critical to get into the ICU. That's totally not true. I mean, if you're critical to get into ICU, you can't wait. That's the fact. And to say that we don't have enough ventilators is also not true. We have ventilators, but nobody can say at this point whether this will be adequate for the next 10 days to come, because that will be synchronous to the amount of critical patients that we have. And right now, hospitals are only accepting stages 3, 4, 5. These are semi and critical patients. For stages 1 and 2, the asymptomatic ones, and the mild symptomatic ones, they have a little bit of waiting time. And they will get into the low-risk treatment centers, which is existent and taking in patients. The cycle, timing and all, have the timing differs in the sense that the case detection and the contact tracing and things like that. Yeah, so there is a little bit of waiting time, but to say that they're not getting the care that they need, I think it's not true. There is also phone assessment being done to give daily calls to check on their conditions, to see whether they're doing okay or not, whether they need to be getting to hospitals or not. Yeah, and coming to public using the word, the term critical, I think the definition differs. Yeah, I wouldn't say everybody's able to say who's critical and who's not. And at the same time, we do have to admit that there's a lot of anxiety, revolving around this whole COVID-19 crisis.
Yeah. Okay. Yeah. Well, don't you agree that, Doctor, psychosocial support is also important in times like this? And I understand Mercy Malaysia has actually set up a helpline for Sabahans to call if they face anxiety because of the pandemic and all that. Have you seen a drastic increase in calls? Has the helpline been useful for Sabahans?
It definitely serves a purpose, which is why on Mercy Malaysia side we have embarked into this psychosocial intervention, more of a bolster, sort of a comfort. And what happens is that there are two big groups, probably one small group and two big groups that are affected. One being the healthcare workers. the other being the patients of the COVID-19 itself, and the third one being the families of the patients who are affected by COVID-19, and also the general public. So we have been receiving calls. There have been other NGOs as well offering this. So we have been receiving calls. There is a need for it, and it has also been a good platform for patients who, to reduce anxiety, in the sense that because there is this common relation of COVID-19 to death.
Yeah.
So I think whoever who's declared positive has this idea, conception that they're at risk of death. So I think that is that's causing anxiety, but at various levels, various intensities. For some, they might cling on to a better story of it. Listening to how stage 1, stage 2 patients get into treatment centers and are bored or walking around, reading books, playing games, and come out without feeling anything. But some tend to cling on to stories of the horror stories of COVID-19, where it ends in death. So in that sense, the psychosocial support offers a lot of comfort, a lot of precise information per se to tell them that, look, this is what happens, and in case of any symptoms coming up, you have to be calling the professionals, the helpline 999, or referring to a doctor. But otherwise, you could comfort yourself with the fact that this will pass. It will be a phase, and things will get better. Yeah, and for healthcare workers, I think it is more of coping to the stress of working.
Yeah.
I think it's not so much about the hours. Doctors and healthcare workers are usually trained to work long hours, but it's more of the amount of stress that the PPE puts on each of the staff. It drenches you, basically. You get dehydrated. By the time you come out, you have lost so much of water and salt out of your body. When the cycle happens, twice in your shift or thrice in your shift, and it goes every day before you go on a break, I think it really drains them out. But there's much you can do to it because of the demand of the situation. You have to wear the suit. It is a bit better for those who are working in air-conditioned spaces, as in ICU and HAW and high dependency wards and things like that. But those who are working in regular wards with no aircons, I think it's a bit tougher. So channels like this offer comfort to them, and we're able to recognize and identify whether this particular individual needs professional intervention or further treatment or not, or whether they're fit to work or not.
Are they all volunteers on the other line? All Mercy Malaysia volunteers? Are they trained counselors, professionals in their field?
They're trained psychologists. They're professionals. They're volunteers, and we have some partners as well.
Actually, how do you manage the flow of information? I mean, like over here in the peninsula, we're checking our social media, and it's like, wow, Sabah is collapsing, and people are just spreading all this fake news.
Yeah.
In Sabah itself, because I'm sure healthcare workers, they work in the sort of a bubble, they're in the hospital as well, and then when they check the social media, is there a state of panic over there in Sabah right now because of social media?
That's a tough question.
Sorry.
Let's put it this way. Writing is good, but there has to be a balance, in the sense that let's give the actual perspective, and at the same time we also need boosters. You see, I have to be honest about it. I think I'm reading too much of negative articles online, on social media, too much of negative posts saying that this is not enough, this is not being done, this is getting bad. We understand that it attracts all the sensationalism, but I think what is needed in this situation is also giving encouragement and motivation to the staff that is working on the ground. I mean, any crisis per se defines that there will be a crisis and conflict in the workforce, in resources. If not, we would not even name it as a crisis.
Yeah.
right? You
That's
see?
true.
So the fact is, yes, the manpower, the workforce is being stretched. The other fact is also that we are getting support from the peninsula. We're getting support from the other bodies. We are exhausted. I am exhausted. Everybody's exhausted. But we got to go on. We got to fight this. For us to fight this, I think what happens, what we really need right now is the push, is the motivation, is the encouragement. So in that sense, the sponsors, the donors work. And from Mercy Malaysia's perspective, those are one of the things that we do, is to, sending the supplies, sometimes even without request, in the sense that we would like to give some comfort back, some comfort kits, and things like dry food even helps, something for you to snack in when you're stressed. That's our stress mechanism for most of us. We tend to snack. It's not good in the long term, but in a short term, in a demanding situation, I think it's good. But coming back to the point that I think, if I could speak from a personal basis, I think reading too many negative articles, reading too many negative feedback, I think is a bit discouraging.
Yeah.
And I think once in a while, there has to be stories of how one is working out, working out their spirit and being motivated every day to go and get the work done, to fight this and get things back to normal as soon as possible. I think everybody's trying their best. Everybody's struggling, but everybody's putting a good fight. We have very less people talking about the good fighting spirit, the resilience of the Sabahans per se. The truth of the matter is that the healthcare facilities per se, the physical facilities, has not been in the most optimal conditions in Sabah, especially when it comes to districts. And the staff, let it be Sabahans or non-Sabahans to come out of Sabah to work, has always been resilient, has always gone beyond their capacity or capability to do something, to achieve something for Sabahans. So I think that has to be spoken more. At the same time, asking for help, urging the government to send more assistance in the form of workforce and logistics and things like that. So yeah, a dose of motivation a day will make a huge difference to anyone's on the ground.
Yeah, that's why we're speaking to you. You are on the ground, so you know exactly what's happening. And we want just to see the bigger picture from you as well, because I mean, reading all these articles that we've been reading, it just sends everyone into a state of panic, right? Like Sabah's not going to make it, that kind of thing. But we are glad that everyone there is resilient and fighting the good fight for the rest of Malaysia. But when it comes to Mercy Malaysia, you rely a lot on volunteers as well. Do you need more volunteers at this moment?
Yeah, we definitely need more volunteers, especially if in Sabahans per se, particularly. You're working in the private field as a nurse, as a doctor, medical assistant, lab assistant, anything, even non-medical volunteers. Do step up, come to us. Our contact numbers are in the Mercy Malaysia Sabah chapter Facebook page.
Yeah.
You can contact the office via the number, and you can even start off immediately. We do need, we have certain programs in our mind. For example, we would like to offer medical services for those who are affected by COVID, but not being COVID positive. The population affected by COVID, for instance, in Semporna is being locked down. So there's a bit of difficulty, coming out to the hospitals and getting the medications and things like that. So in the nearest time, we do hope to have medical camps where we can, check the patients or check the individuals in any of the kampungs to offer the medication that is needed in cooperation with the local district officers. Because it is not only the COVID patients that we need to look at. I think we also need to look at the population that's affected by the whole crisis. Besides that, we also do food packs. We deliver food packs to those who need it, for those who are affected by this crisis, have lost their wages or have lost their jobs. So we are supporting them by, supplying them basic food packs that are able to, last for a week or two.
Yeah.
As a urgent assistant sort of a thing. So we need volunteers to be able to transport these food packs. We also need those who actively look for
Actively who do
Okay.
publicity to be able to raise funds for us to be able to deliver more equipments and supportive items and reach out more. Yeah.
Okay. So you're calling for Sabahans only specifically. Can volunteers from Peninsula help as well?
Can definitely.
And
I think-
Sarawak?
Yeah, definitely. I think there's a lot of assistance that can be done. If the volunteers from Peninsula per se are interested, they can go through our Mercy Malaysia headquarters. Their numbers are all online on their Facebook or at www.mercy.org.com. There are a lot of information there. You can enroll yourself, you can register online and make yourself available. If needed, they will be deploying the volunteers from there over to this side. There are also other things that we can do is to continuously, social media being the most powerful channel and tool right now, I think we can optimize it more in a positive manner. We can spread good messages like our publicity posters to be encouraging more people to donate to us, so that we're able to achieve more and assist more people out there. Yeah.
Okay. Now, doctor, as a medical professional yourself, how do you see this panning out in the next few weeks? Do you think hopefully this will dip, the cases will dip coming in the coming few weeks, or are you foreseeing a spike in cases?
Okay, to be honest, I don't have the expert qualification to precisely answer that.
Yeah.
But in a general opinion, the cases is definitely surging. It's definitely going up. We're not exactly sure when we'll be reaching the peak. What we are sure of is that the modality of treatment, the modality of the protocols of managing the patients, managing the numbers, is getting by the days. I'm not sure how bad the surge will be after this, and the effect of our treatment or for modalities will definitely be tested with that. But if I follow, if I were to refer to what DG has mentioned, our Director General of Health, he has mentioned that the CMCO is starting to show its effect on cutting down the infectivity rate among the people. So if I take that into consideration, we should be seeing a decrease in cases. I don't know in the next few weeks, but I'm unable to say that right now. The number of cases are still high. I think what is more important in this sense is that, to me personally, I've stopped looking at numbers except for the last 1-2 weeks, due to the fact that I do not have any personal control on the numbers coming there. Right. So what is more important that I tell my friends and whoever I can is that you at home, you being in the public, have to keep yourself safe. You have to wear a mask. You have to sanitize your hands regularly. You have to be at home if you have no business outside. I think that has to be put clearly. Instead of panicking at the numbers, I think we could be more panicking at ourselves and the people around us to make sure that this is being done obsessively. I think a little bit of obsessiveness on this part it helps a lot. It helps a lot with the crisis. Yeah.
Actually, what do you think of all these people who suddenly they're so obsessed with the numbers? They're like, oh, they suddenly become COVID experts because, and then they suddenly know everything there is about COVID and how things should be run, how things should be done. What do you want to tell people like this who are just spreading all this news on WhatsApp and whatnot?
We call them the COVIDologists.
I like that term, COVIDologists.
The degree comes from Facebook, the University of Facebook. Yeah. So since WhatsApp is owned by Facebook, so yeah, we can call it the University of Facebook. So what I can say that is that let's to put some logic into this is that we have more deaths occurring from road traffic accidents on daily basis. I think it's by triple or quadruple or even more on daily basis. And it's been happening for years. And Malaysia being, in one of these countries with very high rates of road accidents, you don't see people panicking. You don't see people talking about it in WhatsApp. I think all the sensationalism is there. It's because of COVID-19 being a crisis. Since it's being so talked about, everyone.
The worldwide pandemic, right? Everywhere in the world.
Yeah. So I think everybody's trying to, probably challenge your jobs, trying to be the reporters and DJs, and trying to convey, trying to be the first. I think in this time of social media peak, we have this trend of who's going to be the first to convey the news, who's going to be the first to post this message or news in the channel or WhatsApp groups. So people are just being people. We can't exactly blame them, but what we can tell them is I'm repeating what I mentioned earlier, is that the numbers are good to know. It's good to know what's happening in the country. Don't be me, but it is also good to keep spreading the positive message, which is there's three things: sanitize, mask, and social distancing. I think this is more important than spreading the numbers. I could say we have examples of few of our friends. I think it's no secret that we have positive cases even among healthcare workers. I mean, we being humans as well, we have infections as well and exposures as well. I think almost every one of us have very close brushes with someone who's positive, even myself. I actually held a phone that was belonged to someone who's positive, for the simple fact that he was trying to show me a graphic that I had to take a look on. But I've developed this obsessiveness in sanitizing my hands. So right after holding the phone, of course with a mask on and social distancing, right after holding his phone, I sanitized my hand immediately. Little did I know this saved me from getting infected, because the swabs done after via the contact tracing came out to be negative. So whatever strain it is, no matter how aggressive the infection is, I think this is what that saves us. The mask really works. The sanitization really works, whether it's by soap or best to be done by alcohol, which is 100%. So I think as much as we catch up with the numbers, people have to really be obsessive and spreading these messages. And to those who are quarantined especially, I think it becomes our social role to social police these people, to make sure they stay at home. If they are seen outside, I think what they have to do is report immediately. I think that would be more important. Yeah.
Okay. Now, Doctor, lastly, what's your message to all Sabahans battling the pandemic right now?
Okay. To all Sabahans out there, we've always been resilient. We've always been strong. We've always have less than what we should. But we were never lesser in spirits. We were never less in unity. I'm a pseudo Sabahan, so I'll just put as a V. So keep fighting the battle. Don't give up. But that being said, those who need a break, those who need a rest, please pick up. Get the rest that you need. Get the help that you need. It's okay to give up, but the rest of us will keep fighting the battle. Stay strong, stay healthy. I think for the general public, do what we need to do, as what we have always done. Follow the SOPs, follow the protocols, and hopefully this is over. This will be over soon. Yeah.
Okay. And how about the rest of Malaysia? How can we help Mercy Malaysia in battling COVID-19 in Sabah?
For the rest of Malaysia, I think your kind deeds, your kind donations will be the most helpful at this period. And those who wish to volunteer, please join in. There has been a lot of volunteers throughout the years of Mercy Malaysia. Thank you to each one of you. Some have been there for 10, 15 years, 20 years. So we would like to expand the family of our volunteers. This will be the best time to enroll. For those who wish to donate, those who wish to be, those who cannot spare the time but wish to have a part, could always do so by donating to us. We have our Mercy Sabah Fund. We have the numbers in our page. We also have the Mercy Malaysia Fund, which is also available through Mercy Malaysia's website. Do step up. This is not a Sabah war. This is not a Sabah crisis. I think this is a Malaysian crisis. By protecting Sabah, we are protecting the whole of Malaysia. By protecting Malaysia, we are protecting Sabah as well. I think everybody has to follow the SOPs. Do keep coming in. We welcome all the support and all the donations coming in from the public. Yeah.
Best to
Well
donate
said.
funds, right?
Yeah. Very well said, Dr. Anba.
Yeah.
Thank
Thank
you
you.
so much for this chat. Yeah.
Actually,
Thank you.
on a personal note, funds is always better to. I mean, it's because we don't know what you need, right? It's best to just give money, right?
Some are always interested in donating items. I think there's nothing wrong with that, but it's always good to check. It's always good to check with. This is not only for Mercy Malaysia, on a general perspective as well. If you're sending donations to hospitals and health centers and things like that, it's always good to check with some representative from the centers to exactly know what do they need and how much they need. How much do they need cannot be exact, but what do they need needs to be really exact. Because from the sense of this is something that I learned from Mercy Malaysia, is when we volunteer, when we want to help, we need to make sure what do they exactly need, what is the sort of help they exactly need. We cannot help what we want to help, we need to help what they need. So by doing that, we are meeting the demands of the population, in this sense the demands of the centers. So those who wish to donate is even better. Mercy Malaysia has good ties with the centers, and we are able to identify the needs as it comes from the requesting centers directly. But those who wish to donate items, it's always good to check before you purchase the items. So there'll be better coordination of the assistance being sent, and it will reach more effectively to the beneficiaries.
So what is needed is on the website, or do we just rock up? Because I know Mercy Malaysia is in, I think it's opposite Tropicana City Mall. It's at the Oval here in KL. Do we just rock up to the office and like, hey, PPEs? Or how do we do this? Check out online first, or what?
They can call the numbers available to check on items if they wish to donate. But on a larger scale, we definitely prefer funds to be coming in. But those who have already bought per se, they wish to channel, they could definitely contact Mercy Malaysia to speak on logistics and which centers which they could channel to. Yeah.
Because earlier you
Alright.
mentioned snacks, right? I don't know what kind of snacks they want.
Like if corporate sponsors were to want to come in to give
yeah,
the
twisties, yeah.
frontliners some snacks, yeah.
I think what's running around the hospital at this point is usually I'm not supposed to mention brands, right? So it's going to be like instant noodles. This is tough. Biscuits, 3-in-1 drinks, hot drinks. Usually around things like that, and some prefer isotonic drinks as well, because
Sustenance,
it
Quick
instantly
sustenance
recharges
as well,
them
right? Yeah.
after. Sorry.
Quick sustenance, like you mentioned instant noodles, all right? Yeah, just something to put in, and then I gotta rush out and go for another shift, right?
Yeah, and it's also the comfort factor. It's always strong tasting.
Yeah.
And Sabahans love soup a lot, so yeah.
How long have you been in Sabah, Doctor?
Pseudo Sabahan.
I've actually just reached 12 years. Yeah.
12 years.
That's
just
not only
reached.
12 years. That's quite a long time.
Because
Okay.
I still feel that there's a lot to explore and to know about the state. I cannot brag that I've been here for 12 years and I know so much about Sabah. I think there's so much left to be explored.
Yeah.
Yeah,
Well,
yeah.
thank you so much for your time. We know it's a trying time for everyone right now in Sabah. So yeah, thank you so much for your time, and all the best, and stay safe.
Thank you for the opportunity.
Thank you.
It's definitely great to speak to you guys.